Carlos va vous parler de quelque chose qui est peut-être l'avenir du traitement de la sécheresse oculaire, qui est donc l'IPL, mais en laser. En gros, hein, pour résumer, c'est-à-dire que vous aurez un faisceau homogène que vous pourrez donc diriger sur les glandes sans avoir la dispersion lumineuse que l'on peut avoir sur l'IPL. Merci Carlos, encore une fois, de nous présenter cette très belle technique.
Pablo, and thank you for the organizer for this successful meeting. And actually, I'm going to talk about the laser. Till now, we have the experience with the IPL, but now we are moving to a next step. So I'm going to present our preliminary studies and using a laser. And as far as I know, it is the first time that we use a laser to treat our patients with dry eyes. We use a laser that is manufactured in Italy by DECA. And here we have the device. No, I have to go back, but the small one. Okay, sorry. But the small one, it doesn't work. Okay. So this is more difficult than the dry eye management. Okay, here we have the system and the handpiece, and this is a laser. The name is Red Touch, and here we have the wavelength that is 675 nanometers, and it's a laser that has been previously used in dermatology and dermostatic, and here we have the most important features of this laser. It's moving in these wavelengths, and also the dermal optical thrombolysis is 0.7, and use a scanning system, the 15 millimeters, and the most important is the main effect of this laser is that induced heating in the area and producing a denaturation. This is the special process that has been used in dermostatics. And the final effect is we have a better collagen, and we could obtain more fibers and that improve the patients. So, but the question will be, why a laser for the treatment of dry eye patients? And as many things in science, we discover accidentally that our patients that using this laser just to improve the lid dynamics, just to improve how the tear film improve after the blinking, we discovered that the improvement of our patients related to the ocular surface was better, was not proportional to the improvement that we saw with the blink, the eyelid dynamics. This is why we thought that maybe it was another effect related to the laser. And then we discovered that most of our patients had a better things related to the inflammation. And then we believe that maybe one of the hypotheses that the laser works in dry eyes will be the anti-inflammatory effects. And then we designed two studies just to understand what was the effect of this laser in dry eye patients. First was a study, a clinical study. Here we have the demographics. We studied 69 patients, 37 with dry eyes and meibomian glands. Here are the clinical evaluation, following the use two recommendations. And here we have the lab study related to the inflammatory effect. We had to see if really the laser improved our patients, improving the inflammation at the ocular surface. And then I have the advantage that I'm working in a hospital that we can do some research related to the transcriptomic RNA studies, and then we can analyze the, in this case, 549 genes related to the inflammatory, the most important inflammatory pathways. So that is really interesting thing to understand what happened when we use, in this case, the laser, but also the IPL or other technologies. Here we have the methodology that we use when we apply the laser. And as we can see here, you look at the slide, we combine the periocular area, as we can see here, with the standard handpiece with these parameters. And also, we have a special proof and a special handpiece like a pencil, as we can see here, that we use directly to the skin of the eyelids. The difference is that it's not necessary to touch directly the skin. We deliver the energy at 1 millimeter distance from the proof to the skin, as we can see here. And also in severe cases, and not it is the case, it's just to show how we use this pencil proof, we use directly to the conjunctiva. So we combine periocular area directly to the skin and also at the conjunctiva. Remember that we are talking about another technology, the laser, that is completely different than the IPL. So it's not comparable, both technologies. Of course, can complement one and the other one. But in this case, the technology is another story. So here is the spot that we use when we apply the small handpiece on the eyelids. And just to summarize the effects briefly, I can show you here the most important results that we obtained in a 6-month follow-up of our patients. And it's interesting here because if we can see all the results, and here is the percentage of patients that improve more than 10 units comparing the standard dry eye treatment, I mean, related to the artificial tears. We can see here that the improvement with the red eyes, the laser, is much higher that regarding the no red eyes treatment. And it's interesting too because we can see that the results are quite similar when we analyze patients, young patients, regarding the old patients. So, well, this is one of the results that we have seen in our patients. So the breakup time, we have seen that improving after the 6 months follow-up, and it's interesting too because after 14 days after the first session, the first treatment, we have a very nice improvement, and the same related to the shimmer test, the same with the tear meniscus height. We can see an improvement in the meibomian gland assessment and also the eyelid margin. And as we can see here, very significant, all the statistic analysis, the conjunctival injection, and also the osmolarity. I think the osmolarity is a very interesting tool that, well, maybe is not very use it in nowadays. When I ask about my colleagues if they use the osmolarity, they say, well, not so much, because, well, maybe it's not necessary and have a special cause that must be added to the other diagnosis test. But in my case, I think it's interesting because we have, with the osmolarity, that it's a biomarker directly related to the inflammation. So I think the osmolarity, it's, nowadays, it's again interesting, at least in my hands. So related to the lab study, that it's really the most important in this case because the idea was demonstrate if it really the laser improved the inflammatory reaction at the ocular surface. We see here that we detect the genes, and here we have the top 20 upregulated genes. All are related to different pathways of the inflammation. And just trying to summarize that result, we see here that when we analyze the 5 most important or overexpressed genes at the beginning, at the pre-op, and then we compare the result after the treatment with the red dye, the laser, the post-op, we see here that the difference comparing the pre and post result are very significant, as we can see here. And also it's interesting too, because here we have these 5 most significant genes, and one of the most important, or maybe the most important, is the the cells, the T cells 17, that you will see that are in the middle of the pathogenesis of the dry eyes, as has been pointed out also for Rolando. Also, when we analyze the correlation between the lab studies, the genes, and the clinical results, we also see a high correlation between all these parameters studies, especially related to the lid margin, because most of our patients combine dry eyes and meibomian gland and the dysfunction. And once again, here we have the distribution of all the genes that overexpress related to the inflammation and relate to the different pathways. This is interesting because briefly you will see how it's interesting, this slide. Trying to explain how the laser improve or reduce the inflammation at the ocular surface, we speculate about the mechanism of the inflammation. And in this slide, we see the para-inflammatory procedure that we see at the ocular surface. There are many stimulus that produce an imbalance in the homeostasis system, and then finally induce the inflammation. Trying to summarize again the inflammatory reactions, we have this arc that we can see in different publications. Here we have all the inflammatory mediators that has been described. Don't worry about this. I don't go to explain all this one, but I think the important in this case, analyzing all the publication, is that all the inflammatory reaction, not only at the surface, is here with the stimulus produce the first damage, and then these cells, the T70 cells, move to the ganglions, and then there is a recruitment about more cells, especially the T-type, that goes again to the surface and then produce this inflammatory arc that is really dependent about the severity of our patients. So what happened with the red dye system? We have seen that previously the 5 most important genes that has the higher overexpression and goes down after the treatment was the TH17. And here we have the hypothesis. The laser will induce some downregulation directly, the action over these cells that at the same time activate in the second plane other cells that produce, deliver all the mediators of the inflammation. So we speculate that the effect that we have with this laser, one of the effects, because we can talk about the hypoxia if I have times, but one of the main actions with the laser over the ocular surface in patients with dry eyes and meibomian glands will be related to the effect that we obtain down-regulating these cells that are in the axis, in the center of the vicious cycle that are described around the inflammation in that patient. Here we have the immunogenic map where we are working. And here we see the different pathways that we are in this moment studying, just to explain more about the laser, but also the IPL or maybe other treatment that can improve the inflammation in our patients. Of course, it's really important just to understand what happens when we use treatments, for instance, the cyclosporine, but other pharmacological drugs or any other technologies like the new laser. So, in conclusion, we can say that the the laser, in this case, the red dash, the 675 nanometers laser can improve our patients. We use 4 seasons separated by 2 weeks age season, and the genetic expression of the inflammatory pathway, so a very important downregulation of the genes that we are studied. And another important thing is using the laser. In this case, we had not found any case of side effects, burning. We were talking about the IPL. Of course, if we use the IPL in the appropriate parameters, it will be very safe. But in this case, we know, like the dermatologists or dermosthetics, that the laser, if we also use the appropriate parameters, is even more safe than the IPL. So this is why we promote, in this case, when we talk about the inflammation, move to the laser. But of course, there is a complementary technology. So forget it about if you have the IPL and then move into the laser, it will be the best for your patients. I think you have to combine both technologies. I'm sorry, it represents more money, finally. And of course, we need more studies just to understand more about how the laser works, before to launch something that it's new, and laser is like a magic word for the patients. So I hope that maybe in the next future we'll have a new technology that could improve our patients with dry eye, and in this case with meibomian glands. Thank you so much.
Thank you very much. Merci beaucoup, Carlos.